Hello all, welcome back to Pathologue, a dialogue between a surgeon and a pathologist. I am Dr. Srikant and with me today is Dr. Jefferson and we are here to discuss about dry socket. Welcome Dr. Jefferson.
Welcome Dr. Srikant.
Last time we discussed about the importance of blood clot inside the socket and you mentioned about a painful condition called dry socket that initiates because of this. So can you give me a background of the hypothesis behind how the clot can be lost?
A dry socket is a separate entity. This happens after the first 24 hours, supposedly when all the proper precautions are all taken care of, and then there's a different pathological process which occurs, which causes the clot dissolution. So basically what happens is the plasminogen gets converted to plasmin due to any influence of any viral or bacterial toxins and causes dissolution of the clot. The important clinical features of these are the socket may appear grayish or yellowish gray. You can see a lot of necrotic or dead tissue, and sometimes even the bone can be exposed. And this happens after a period of 1 day, maybe 1 or 2 days. And if the pain of the patient is increasing after the second day, then most probably we'll have to rule out dry socket before we see any other causes for the pain.
Okay, doctor. As you said, dry socket can be not only because of physical loss of clot, but also dissolution because of a plasminogen mediated activity. And you said the patient has severe pain. What is the nature of the pain? What kind of pain is this?
This is a severe pain because it is because of the kinins which are being released into the socket, and the bone exposure, the nerves which are exposed, it all causes very severe pain, and the patient usually is unable to bear the pain. So it leads to a lot of patient discomfort and panic. And when they attend to the dentist, the first and foremost thing that they are looking for is pain relief more than the actual healing of the socket.
So is there a way to predict who will be getting or who may have a higher chance of getting dry socket?
Yes, it usually happens more in the mandible because of the bone which is there, the cortical bone.
Correct. It is more dense and the vascularity is also a single line of vascularity, unlike the maxilla.
The vascularity is reduced, and the hard compact bone, when there is extra trauma to the area during the extraction procedure, it can lead to a dry socket. So they say most oftenly it is found in the mandible, posterior tooth, and the highest percentage is seen after removal of impacted lower third molars.
Yes, there is around 30% evidence that third molar extraction, which is deep-seated and impacted, has a chance of dry socket being developed. So if a person has this particular dry socket, how do you manage them? What is the treatment for that?
The treatment plan first is pain relief, then allowing healing of the impaired wound socket. The initial part for wound relief, some analgesics can be given, but a local treatment by a local gentle clearing of the debris along with maybe a sedative dressing can be used for pain relief.
Alright, what sedative dressing do you prescribe and how do you place it?
Commonly available sedative dressings are zinc oxide eugenol or clove oil, which can be used along with a cotton as a sedative dressing, and there are also commercially available medications like Alvogel, and there are more experiments on that. Newer materials are being in the market to treat as a sedative dressing.
Alright, so what about the healing process? Is it speeded up or is it delayed because of the formation of a dry socket?
Yes, definitely it is delayed when compared to a normal wound healing process. It takes a longer period of time, maybe beyond 7 to 10 days time, and the patient has to come for review every alternative day at least to check whether the wound is being healed. It heals by secondary intention, so it takes a longer time to heal.
Alright, Dr. Jefferson, thank you for the insight into dry socket. I'm sure all of us would be benefited by the insight. Thank you very much.
Thank you, Dr. Srikant.